have an equally important role to play, and it is absolutely imperative and essential for the public to play their role. And we'll find out why, because we've got here with us Dr. Anuruddha Pedeniya, who is of course no stranger to the show. Good evening to you, Dr. Pedeniya. I see you presented to His Excellency the President COVID-19 exit strategy Sri Lanka and the reinforcement by October 2020. What, in simple language, what is this reinforcement October 2020? What's that about?
Let me first just highlight the facts what we highlighted in the COVID-19 exit strategy Sri Lanka presented to the government, and this is in our website to the President. So basically what we studied is the coronavirus, how it comes and kind of have impact on the country, was initially explained from a principle called this hammer and dance theory. When you get into a country, it is coming from outside and it is considered as a public health emergency, and at the same time it's a global pandemic at the moment, so it's a global challenge.
Yeah.
So therefore we got the first infection coming here in this January, but that was not infective at all. But the next first local patient we could get in March, and ultimately there was a surge of patients. So what we did was, there are three parties to contribute at this point. That is the political will, since it's a public health emergency. The second thing is how far the health capacity can cope with it. And the third component is the public contribution. So these all three stakeholders had to take part in order to handle a public health emergency.
Are they in equal measures?
Equal measures. So therefore what happened was, we had to train each these components. So that is why the entire country was that was put to a complete lockdown, and all these components were reinforced to handle this situation. So and basically during that process it was expected more than 80% restriction of movements. We call it the curfew or lockdown or whatever. The expectation is more than 80% limitation of their movements, public movements. So having achieved that, we could control. So we call it the hammer phase. Then what will happen is, until we get a vaccine in place, we will not go to the complete normalcy. That we consider as the third phase. So now we are in the middle phase, that is we call it the dance phase, where ups and downs of patients coming and fluctuations, and we have to handle that fluctuation. So having realized the behavior of this virus and the way it is spread in the country, you can see this hammer and dance theory. So we are in the dancing phase, and having
you could show that figure again after the
you can see now this is the hammer phase, where we aggressively approach the situation, and ultimately we have come to the dance phase, where we have a fluctuation of patients ups and downs in the country. So how to handle that situation? So we are expecting some patients at certain areas. So therefore we basically propose a kind of a strategy which is very simple, that what we practice in a surgical theatre. Now for instance, in a surgical theatre, when we are operating on a patient, it is supposed to be sterile. You can't have germs inside the theatre. But outside is contaminated zone. Then every day you wheel patients inside the theatre from contaminated zones to the sterile zones, and you wheel out them as well, without contaminating the surgical theatre. So there are certain principles that follow in either zones at the same time when we are crossing the border. So basic principles were identified, and we decided to classify entire country depending on, if you have patients, that will be a red zone. If you don't have patients, it will be a green zone. So in the country, if you take AGA divisions, there are 333 AGA divisions. If you go by police areas, there are 495 police areas. So whatever, and if you go by the GS divisions, the Gram Sevaka division, there are 14,000 Gram Sevaka divisions. So whatever it is, what was expected is, if there are patients in a zone, that zone will be a red one, and the zone will be lockdown. So therefore the zonal lockdown is what we proposed. So therefore we developed criteria to identify an area as a red zone, green zone and a yellow zone. Plus we, in this document in way back in April 2020 we proposed the governance structure for each zones.
Right.
Now what happened was, if you analyze that from that point, today there are 64 police areas are under so-called lockdown situation or restricted movements.
Right.
At the same time, you can see out of 490 odd police areas,
divisions.
the majority are in the green zone.
Right.
So now what we have to try is to minimize the red zone or shrink the red zone and to expand the green zone. That is what we are now working on. So at the same time, you have patients, you have contacts, and you have travelers coming from outside to this country. So we have to handle all these individuals for their best interest, at the same time safeguarding the country. So today actually what we proposed is, now we are in a position, this is a highly literate country, so the public support had to be at a very high level or optimized level. So having realized that, and the government commitment is there, and health sector is fairly doing well at the moment, with the help of army, police and all the ancillary parties supporting the health to handle the health challenge. Taking all these things into account, what we propose to the president is whether we can, and the other point is majority of the patients are asymptomatic, and this is going to last for about minimum 1 year according to the WHO predictions. So taking all these things into account, what we propose to the president is, let us develop two important things. Now as an individual, every day morning you want a prescription. There's COVID on this side, what should I do? Then for caregivers, you want a zonal prescription. We are having this zone as a MOH, what should I do? If I am in a green zone, this is no normalcy. We are in the new normalcy, so therefore you are supposed to propose the contents of the DREAM, that is the D for distancing, RE for respiratory etiquette, and A for aseptic techniques, and M for mask. So those are, you have to do until you get a vaccine one day.
Right.
So
those are the DREAM is
that is the bottom line, the green zones.
That's the bottom line.
Yeah, that's the bottom line. And you need not to do your unnecessary visits, gatherings and other things. We have to use, should not bring corona home. So that should be your basic aim.
Is it a good idea, doctor, to put on hold or postpone at any rate your gatherings, like weddings, homecomings?
No, I don't say that you need to postpone, because if you see the document we have published with the Ministry of Health and WHO, and this is available again in the website.
What's the name of the website? Have you got the name, address of the website?
Yeah, this is in the website. That is the Ministry of Health website.
The advocacy brief.
Yes. So if you advocacy brief, if you see this book, now if you want to have a wedding, there are guidelines to follow.
Okay.
If you want to have a funeral, there are guidelines. We don't want to completely shut down these activities. If you are running an office, there are guidelines. If you are traveling in a bus, there are guidelines. If you are traveling in a tri-show, there are guidelines. So there are all, I mean, we are not asking you to completely shut down all your work and to work, but
sorry to interrupt you, but what about what we've done here? This studio that you're in is specially built away from the main building.
That's the thing.
For this program and others as well. Is this a good idea?
Exactly. Really, we admire this kind of principles. Now, when I came here, I am not allowed to move around all over your institution. I am only allowed to come to this. This is just
like making a bubble visit.
Yeah, next to the car park, and only I will be fairly reasonable outside, inside kind of situation. So the principle what we have proposed is to have a compartmentalization, because what we observed, when the Navy camp was infected, the entire crowd got infected. So if they had a compartmentalization, that shouldn't have happened. Now even the brandings, when it happens, the entire unit or entire organization got infected. So that is because you are crossing the borders and moving around all these areas. So if you can develop certain principles other than the mask and washing hands and other things, that if you need not to come to work, if you can work from home, they let them work like that. And even if you come, if you need not to move around all these places, need not to say that you are not going to be very moody and rude to the others, but unnecessary contacts, and even if you have a contact, if you keep the meter distance, and those basic principles to be adapted in order to, now even in this document we have told, in order to, we have spelled out like this. Now what we said, the GMOA want to highlight a need of an individual prescription to act upon by individual. At the same time, for all care delivery personnel should have a zonal prescription, how they should enforce these principles into the zone.
Okay.
At the same time, we have emphasized the fact that importance of maintaining the COVID-19 care with minimal interference to the livelihood of the public and safeguarding the economic and the general administrative activities of the country.
Right.
So therefore, what we are going to cope up at the moment is, we are going to live with COVID for a while safeguarding the normalcy as much as possible with regard to economic activities, general administrative activities, your livelihood, and so on and so forth. With that view, we propose to the President through this reinforcement document about 6 points, and we had about 2.5 hour discussion with the President.
We'll come back, Dr. Pedeniya, to those 6 points that you discussed today with President Gotabaya Rajapaksa after this short break. Don't go away. After all, this is Newsline Live.
Newsfirst, Newsline with Faraz Shaukutali.
And welcome back to Newsline Live, where we are in discussion with Dr. Anuruddha Pedeniya from the GMOA. Now then, thank you very much for your questions by SMS, as always, to 0772 300 305. And our wonderful producer of several years now, Harshana, will put that card up on the screen shortly. 0772 300 305. And Dr. Pedeniya, one question which several people have actually sent it in the same question: does the pandemic live on the surface of fish, especially as it was said earlier that it does live on things like currency, stainless steel, etc., etc.?
That was not technically proven, but you know, very unlikely that with that environment to live on a fish. But more than anything, what they have observed by the authorities who have went there, these people have shared the same cigarette, they have shared the same glass, they have shared, so the more contact, less than 1 meter contact, not wearing mask, is the main reason why it has spread, not because of the fish.
Not because of the fish. So the answer is no.
I mean, in the science you can't say no, but it's unlikely.
One simple question, well, I don't know if it's simple. Is the GMO happy with the way the COVID task force, headed by the Army Commander Shavindra Silva, are you happy with how his team is handling things?
I think this is a public health emergency, and I said a global health challenge. And ideally the health should be leading the process, and with regard to quarantine and the other activities, the Army has come to help us. So I think not only the Army Commander, he's working hand in hand with the health sector. So basically us and himself is doing some media, so from a point of view, from the outlook, the media may be reading and the public may be reading that if the Army Command is heading the task, but basically it's the health sector is leading the task with the help of the military, police, administration, and so on and so forth. So I think the clarity of his presentation would have given a kind of an impression that Army is leading. Army is leading the quarantine process, but the rest of all treatment and other activities are
clearly done by the
health sector.
So well, that's a nice diplomatic way of putting it. As we are going to live with COVID for a while, is it safe to swim in a common pool, and given that the pool is chlorinated?
This contamination through swimming pools is not reported. So it was a previously asked question. So you need not to bother about going and swimming at a risk of kind of corona. But importantly, when you go for swimming, if you have contacts with the others and how you are moving, might contact corona, but swimming itself is safe.
Right, and somebody is asking about construction activities, that there's hardly any social distancing going on there, and the wearing of masks by the workers too has been noticed. Is there a problem?
We have given guidelines when a construction site how it should function in this. All three languages this is given. So it is ideal that if everybody take these measures up for their safety and for the continuation of the services what is expected from a economic point of view of the country as well. At the same time, if you have managed everybody in one location who are not allowed to go and get contaminated outside, like that if it is a if it is a construction site, every day you are working on the same side, the meals and other things are provided without any contamination, of course, then you can relax a bit. But if you have moving in and out, and if you are, especially if somebody is coming from a red zone and potentially contaminated zone, then it builds up a lot of risk factors. So it is the duty of the not only the construction site workers, the people who are the contractors, to keep these principles up in hands for the safety of continuation of these activities.
And we at Newsline tonight, we are in conversation with Dr. Anuruddha Pedeniya from the GMOA. We are experiencing a bit of technical difficulties, so the number, the SMS number is 0772 300 305, and tonight again we are in conversation with Dr. Anuruddha Pedeniya. Now then, is it a good idea, and how good is this, if I've been exposed to somebody who is a positive, COVID-19 positive person, and if I've been exposed to that person, how effective is placing me in quarantine?
How effective in placing you in quarantine?
Placing me in quarantine, so telling me to stay at home for 14 days. How effective is that?
That is supposed to be the gold standard at the moment.
Right.
Because now when you get contaminated, there are certain factors we have to consider. Now, how far you got the contact, whether you had a very close contact or whether you have maintained your 1 meter distance, and whether both of you all are wearing masks, and whether you are using the sanitization, and all these things will ultimately lead you to understand whether you are a contact or a ultimately infected person. So after about 5, 6 or 7 days, you will be tested with your COVID-19 to see whether you are contacted with the disease or not.
Right.
So thereafter, if you are not, you can continue as a normal person. So the quarantine is a process where you are in a potentially possible candidate to consider as a contact infected person, but you are not sure until you clarify that through a PCR test or other means of clarifying it.
And how irresponsible is it if somebody is placed in quarantine and they disregard that quarantine and go out shopping?
That is very dangerous with corona, because this is the 6th global emergency we are facing after year 2000 as far as the WHO is concerned. Now, none of the viruses which came prior to this spread like this. They had a mortality or death rates more than the corona. Some of the viruses had a death rate about 40%, whereas the corona death rate is around 2 to 4% range. So therefore it is not a deadly disease from that angle relatively, but at the same time the spread rate is very high. So because of that, it is your responsibility, because that will collapse not only the health of a country but also health in the sense we are concentrating on COVID-19, that we have to understand the fact that then there will be less priority for other diseases to some extent. Plus it will have impact on your general administration, your all economic activities, day-to-day livelihood, all these things. So therefore I think it's very irresponsible for someone who is moving around, who is supposed to be quarantined. And as I told you at the very beginning,
Should the authorities take immediate action?
yeah, immediate action, because we have three stakeholders, I said. The first stakeholder is the political leadership, the second stakeholder is the health sector, and third and most important stakeholder is the public. So unless the public is going to responsibly act on these lines, definitely the other two stakeholders will not be able to handle the situation. So therefore bringing laws is something, but making yourself ethically liable and making the country safe is also part of your responsibility.
And are we moving away from placing everybody into into hospitals, as opposed to, are we moving away so that they'll be sent home and say, look, you be at home, we know you're positive, if you get worse, call us. Are we moving into that scenario?
No, we actually proposed 6 strategies today. Number 1 strategy is the surveillance. Now, what do you mean by surveillance is when you suspect some person or individual who is supposed to be having contact with the corona patient. It is the duty of the healthcare sector to do active surveillance. So they are using most of this technology, the phones and other GPS mapping and all these things to identify the surveillance. But when you think that this person is supposed to be a patient, we have to have a very effective and efficient mechanism to see through PCR testing and other modes of testings to see whether this person is a patient or not. Now, having realized these are patients, it is very important to map them, because we are taking a public health decision. So you are supposed to map by using technology, GPS mapping, and you have to get the green zones and red zones accordingly for us to identify in which area we are living. So we actually had a discussion with the President today, and it went up for about 2.5 hours, and it was very clearly emphasized the fact that the surveillance is number 1 issue in this process.
And that surveillance is being carried out by the intelligence services.
Health sector we are doing with the help of Army intelligence and the police and other administrative information what we are gathering. But what we highlighted is to collect the data, do the PCR testing, confirm those data, verify those data, and ultimately to map it and to present it to the public every day as a statement report, daily statement report, for everybody to be cautious and to act. Now, if you are in a green zone, then you can be happy of it, and if your green zone is slowly becoming red, then again it is your responsibility partly that this region is getting. So that
very quickly, various people are asking us for your opinion on herd immunity.
Herd immunity is a principle some people have practiced in other countries. Now, that is at the expense of people dying, because some people statistically calculate the 2% are dying. So, and most of the deaths are in the elderly populations and who are having non-communicable diseases. So some countries have calculated, let them die, because that will really prosper the country, because you are losing the kind of elderly and the NCD people, relatively disabled people, then the able people will be living in the country for that kind of view, and we don't adapt that policy. So simply in the process, in the principles of suggestions, the first thing what we said is every individuals had to be, when you are collecting the information, to get the information of this vulnerability, whether they are in the vulnerable age group or whether they have NCDs to make them more vulnerable. At the same time, the social vulnerability, if they are living in a kind of a shanty or in a area where they are supposed to get more chances of contamination, to take all these things into account and to develop criteria of their risk levels and to give their alertness accordingly. So when they are going to be placed in the quarantine centers or treatment centers, we said the level 1 quarantine center, level 2, level 3, level 4. So depending on the risk, them to be placed. If it is a very young person who has no NCD, asymptomatic, so that person can be placed, need not to be kind of a build-up hospital, like say the Navy people were in a camp. So place where they will not spread to others is the only obligation and expectation from that patient. But if there is a patient who is elderly having NCDs, he is more chances of having complicated corona and possibly a death at the end of the day. So because of that, let them be placed at a place where you have consultants, and we have ICU facilities and so on and so forth. So this kind of a classification and depending on the alertness, scaling downs, ups and downs in the quarantine and other treatment facilities were the basic technical component. We had discussions with the presidents and we asked them to develop guidelines, circulars in order to operate this.
As we come to an end, Dr. Pedeniya, so the main thing is that the public need to be aware that they have a significant and important role to play.
Correct.
And personal sanitation, hygiene, all that needs to be first class.
Yeah.
Dr. Pedeniya, thank you for first class explanation, and hope you come back on our network again soon. And that's the way it was. Thank you very much for watching Newsline Live. Take care, have a great evening and a great week ahead of you. And of course, as always, God bless you.